Spondylolisthesis is a spinal condition where one of the vertebrae slips out of its proper alignment, typically forward over the vertebra beneath it. This misalignment most often occurs in the lower back and can lead to a range of symptoms, from mild discomfort to severe pain that radiates downward. While many people experience back pain, spondylolisthesis is distinct in that it can directly compress spinal nerves, potentially causing pain, numbness, or weakness in the legs. This condition can arise from various causes. In older adults, it's often due to degeneration from age-related wear and tear. In younger individuals, especially athletes, it can result from repetitive hyperextension of the spine, such as during gymnastics or weightlifting. Genetics also play a role, as some individuals are more prone to developing spinal abnormalities. Treatment for spondylolisthesis depends on the severity of the symptoms and the degree of vertebral slippage. Non-surgical approaches are often the first line of treatment. These include physical therapy with exercises aimed at strengthening the muscles around the spine to improve support and reduce pain. Non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroid injections may help reduce pain and inflammation. For some, wearing a brace can provide stability to the spine and relieve pressure on the affected nerves. If conservative treatments fail and the condition severely affects quality of life, surgical options such as spinal fusion or spinal decompression may be considered to stabilize the vertebrae and alleviate nerve compression. Spinal fusion is a procedure often recommended for severe spondylolisthesis. During spinal fusion, surgeons remove the damaged disc and realign the vertebrae. They then insert interbody spacers made of metal, plastic, or bone. The devices are the same height as the damaged disc, so they fill the open space between your vertebrae. Bone grafts are placed to encourage new bone growth to fuse the vertebrae together, creating a single, solid piece of bone over time. Metal rods, screws, or plates may also be used to stabilize the spine as it heals. While the fused portion of the spine loses some flexibility, the procedure is highly effective in reducing pain and preventing further nerve damage. In some cases, patients may also need a spinal decompression to remove extra pressure on nerves that may be pinched as a result of the slipped vertebra. Surgeons may use one of several techniques to free a pinched nerve. They may remove part or all of the lamina, the bony roof of a vertebra, removing pressure on the nerve and giving it more space. This is called a laminectomy and can also treat stenosis or narrowing of the spinal canal. Surgeons may also enlarge the opening in the spinal canal through which nerve roots travel to other parts of the body. This opening is called the foramen, and the surgical procedure is called a foraminotomy. A third type of decompression allows surgeons to remove part or all of a spinal disc, a thick piece of cartilage that cushions the vertebrae if it slips out of place and compresses a nerve or the spinal cord. This is called a discectomy. Any or all of these decompression techniques may be used during surgery, sometimes in combination with spinal fusion, to address both nerve compression and structural instability caused by spondylolisthesis. With the right combination of treatments, whether through conservative methods or surgical interventions like spinal decompression and fusion, individuals with spondylolisthesis can achieve significant pain relief, improved function, and a better quality of life. Thanks for watching. We hope this video helped improve your understanding. Remember, this video is not a substitute for professional medical advice. Always consult your doctor. If you found this helpful, don't forget to like this video and subscribe to our channel. Better understanding leads to better health.